and welcome to this online program, Perinatal Loss in Practice, What Hospital Staff Need to Know. My name is Dr. Nicole Hyatt from COPE, the Centre of Perinatal Excellence. One of the areas that health professionals often voice they would like further training in is the specialty field of perinatal loss. This request is often initiated by frontline health professionals who deliver care directly to bereaved families. It is for this reason that COPE has partnered with the Perinatal Loss Centre to bring you this quality online training program. The aim of this program is to help you deliver best practice in bereavement care in the area of perinatal loss. And to provide you with this excellent training, I'm pleased to introduce to you a recognised expert in the field, Eliza Strauss. Eliza is a bereavement midwife whom I've had the pleasure of working with on this program. Eliza is also the co-founder of the Perinatal Loss Centre, and she will share with you her knowledge and wealth of expertise in the area. So over to you, Eliza.
Thanks, Nicole. I'm really pleased to bring you this course, which has been informed by the COPE Training Matrix, the 2019 Stillbirth Centre of Research Excellence, the PSANS Clinical Practice Guidelines for Care around Stillbirth and Neonatal Death, as well as my own clinical experience working as a bereavement midwife. Other national and international recommendations and guidelines have also been included, as there is more and more research in regards to care of the bereaved family following a perinatal loss. Knowing what to say and not say, as well as knowing what to do to make these families' grief journey a little bit easier, is commonly what health professionals tell me they would like in training. There is more and more literature available to help the obstetric and midwifery and nursing communities navigate this specialty field, and Australia is in line with worldwide best practice bereavement care standards. It's therefore imperative that you, as a health professional caring for bereaved families, understand the importance of good bereavement care and the impact effective care can have on these families. If good evidence-based bereavement training is provided, you will gain the necessary skills and knowledge, and you'll feel more confident when caring for parents following a perinatal loss. In turn, bereaved parents will receive the supportive and respectful care they deserve. I hope as a result of completing this course, you will feel better equipped and more confident next time you care for a family whose baby has died. So let's begin with an overview of the 5 modules to give you an idea of what you will be working through, starting with Module 1, Understanding Perinatal Grief. This first module will be discussing what perinatal grief looks like when compared to other types of grief. Perinatal grief is a unique type of loss, and the differences will be highlighted in this first lesson. Lesson 2 will go on to talk about the different types of loss, including miscarriage, stillbirth, neonatal death, and termination of a pregnancy. Legal definitions, causes, occurrence, and risk factors will be included in each category of loss. The last lesson, Lesson 3, will look at the common reactions of perinatal grief and what bereaved parents often face in the early stages following the loss of a pregnancy or after the death of a baby. In Module 2, we will focus on the very real challenges and barriers that bereaved parents face following a loss, as well as the challenges you as the health professional may face when caring for these families. Some solutions for overcoming these barriers will be briefly touched on for you as the professional. However, this will be more comprehensively discussed in a later module. In Module 3, we will discuss what happens in hospital and how we can best support a bereaved family in the most effective and respectful way. This is a detailed module, which is the how-to, and will give you lots of practical ideas to make caring for these families less stressful for you. In Lesson 1, we will explore what parent-centred care means, and this will include the 5 core goals of care as outlined in the 2019 CRE and PSANS guidelines. Lesson 2 and 3 will help you as a health professional prepare a bereaved family for admission, care of them during the labour and birth, and most importantly, help them to create memories and offer parenting opportunities while they are with you for this very small window of time. The last lesson will focus on post-mortem and autopsy, as well as initiating discussions around funerals and rituals for saying goodbye to their baby. This is often left to the person directly caring for the family. If this is you, then it's important to be well informed and aware of the processes involved, so you can confidently discuss options with the parents and be able to answer any questions they may have. Module 4 will focus on care after the family leaves the hospital. Support after discharge is a vital part of continuing good bereavement care. There is little point in providing good care in hospital and then expecting parents to sink or swim when they get home. We must act as a conduit between the two environments and give parents the skills and knowledge to access further support if they feel they need it once they're back in their community, and also in the event of a subsequent pregnancy. The last module, Module 5, is about you. We discuss self-care and what this might look like, along with why it's so important when you care for bereaved families in your workplace. Providing bereavement care is often part of our job. However, we need good support from our organisation, which we work in, to be able to do this. So we will discuss what this means and how your organisation may support you to support the family.